name is Elena. I'm the Program Manager for Quality Improvement Initiatives at the Colorado Perinatal Care Quality Collaborative. CPCQC, or the Colorado Perinatal Care Quality Collaborative, is the backbone organization for Impact BH, and my role in Impact BH is to run the Quality Improvement Initiative that's located in inpatient units in Colorado, which is called the Colorado AIM Substance Use Disorder Learning Collaborative. This learning collaborative is focused on implementing screening, brief intervention, and referral to treatment so that patients can be identified in this key touch point in their perinatal journey and ensure that they receive care following their inpatient stay as they return back to the community. The Colorado AIM Substance Use Disorder Learning Collaborative, otherwise known as COAIM-SUD, is ensuring that all patients, despite having prenatal care, will receive screening and then the identification of if they have a substance use disorder or a perinatal mood and anxiety disorder, and receive high quality care during their inpatient visit, as well as being referred back into the community. In Impact BH, this means that the patient has this care within the labor and delivery unit where they're identified as being a high-risk patient. The nurses and providers in the unit are trained on motivational interviewing as well as this key brief intervention so that they reduce stigma and bias and use the correct language. And then they're connected to these high-quality community resources that we've identified throughout the other parts of Impact BH so that these patients are receiving the exact resources that they need, whether this be a counselor that's focused on perinatal mood and anxiety disorders, child care in the community that near where they live, an inpatient program for substance use disorder, financial support, at-home nursing following their labor and delivery unit stay, whatever it may be. This touch point in their care is a place for the patient to be identified as needing that support, as well as receiving those key contacts within the community again. In the Impact BH region, we have one hospital participating. This is a very rural region and there's only a few hospitals, and due to the nursing shortage, they have limited capacity. But the one hospital that has been participating, Valley View Hospital in Glenwood Springs, has had extreme success. Since their start of the program in 2020, we have helped them implement validated screening tools for anxiety, depression, and substance use. And through using those validated screening tools, this inpatient unit has been able to identify all high-risk patients, and for the past year have been screening above 90% of all patients admitted to the L&D unit, as well as making sure that any patient who screens positive for substance use is identified and receives the appropriate clinical care. In the past quarter, in Q1 2023, there was one patient who was identified as having substance use disorder, and that patient received all 4 out of 4 clinical care practices, which means that they receive social work consultation, they have a postpartum visit scheduled before discharge, they're counseled on recovery treatment services, and then they either receive during that inpatient stay or are referred back to the community for recovery treatment services. This is a huge win for this program as well as this community, so that any patient who is in this perinatal period knows that they have the support needed if they are struggling with perinatal mood and anxiety disorders or substance use. The success of COAIM-SUD would not be successful without community-based organizations and partnerships that we've gained within the Impact BH region. The community in the Impact BH region has really surrounded patients who are at high risk and ensured that they have high-quality resources within their community once they're identified in the outpatient setting or the inpatient setting. And this partnership between the community as well as the healthcare setting has really made it so any patient that is identified as having substance use or perinatal mood and anxiety disorders has this huge safety net around them so that they receive care throughout their perinatal and postpartum journey. To ensure that patients are receiving the highest quality care, the community really needs to set up and identify the perinatal population as a key population to support. For this to occur, you need to have buy-in from both the healthcare system as well as community-based organizations. And having this buy-in from both of these systems will help provide this encompassing support so that the community-based organizations can talk to the inpatient units and the inpatient units can talk to the outpatient units so that the patient never has to wonder if they're going to be slipping through the cracks along the way. And so my advice for other communities that are trying this project would be to really ensure that before starting out, you have these high quality relationships with community members, both people who are working in the community, organizations, knowing these resources so that you can immediately, as the professional and as the expert, know exactly what that patient might need, and just continue these relationships. You want to make sure that as the community changes and as the resources may change, you are the expert again and remain highly knowledgeable about all.